The Association of Private Hospitals Malaysia said that the capped prices for COVID-19 tests gazetted under the emergency ordinance only covered the cost of lab charges and were not inclusive of the fees to obtain the sample, cost of personal protective equipment and consultation fee with the medical personnel. APHM made the clarification in a statement today following Health Minister Dr. Adham Baba's announcement that prices for COVID-19 tests had been capped to ensure they remained reasonable. The association's president, Dr. Kuljit Singh, said this was confirmed through a letter from the ministry's Deputy Director General for Research and Technical Support dated June 1st to all the private laboratories. He said private hospitals would decide the final price for COVID-19 tests, which will include the laboratory charges and other costs for the public to choose. The cost will vary from each hospital based on its service and location. However, it will be kept as low as possible to cover the total cost, he said. The government had set the ceiling price for polymerase chain reaction tests at RM150, RTK antigen tests at RM60 and RTK antibody tests at RM50 in Peninsular Malaysia. The ceiling price for RT-PCR tests in Sabah and Sarawak was set at RM200, RTK antigen tests RM80 and RTK antibody tests RM70.